Welcome to eMed's training video for the VersaPump infusion system. Subcutaneously infused immune globulins are prescribed for several medical conditions. The VersaPump infusion system is a prescription device used to subcutaneously infuse prescribed immune globulins. Infusion can be done in the clinic or home setting with or without a healthcare professional. When you open the VersaPump box, you'll find the VersaPump infusion system user manual, the VersaPump infuser, and a carrying case for ambulatory use. Please refer to the VersaPump user manual for how to use, maintain, and troubleshoot the VersaPump infusion system, along with other important information. The VersaPump infusion system includes the VersaPump infuser with carrying case, the VersaRate or Infuset flow controller, a specified syringe model, and the eMed subcutaneous infusion set. Please refer to the warnings and cautions in the VersaPump user manual, as well as intended use and indications. Pages 16 through 30 of the user manual includes information and charts for healthcare providers to select and prescribe a flow controller and administration set depending on the drug used and the infusion rate required. The charts provide system configurations that result in flow rates suitable for initial or maintenance infusions based on the drug's prescribing information. Select the appropriate flow rate table based on the drug to be infused and either the Infuset or VersaRate flow control model. Based on the patient's infusion requirements, the syringe model, and the needle set model, the appropriate Infuset model and VersaRate Plus settings should be selected for the desired flow rate. Clean the work surface and gather the required materials. Make sure that you have the correct flow controller, administration set, and syringe readily available. We begin by washing our hands thoroughly. Verify that the sterile packaging is not damaged. Now remove the flow controller, administration set, and syringe from their sterile packaging. The syringe may be a pre-filled syringe, or you may transfer medications into an empty syringe using standard technique. And here's an example of the Infuset flow controller, the VersaRate flow controller, and the subcutaneous administration set. When the syringe is filled with medication, we're ready to connect the system. Connect the syringe to the flow controller and the flow controller to the administration set using lure lock connectors after removing the protective caps. The VersaRate flow controller is connected in the same way as the Infuset. Now we prime the system by injecting a small amount of medication to remove most of the air until the tubing is filled up to within an inch or two of the needle. Use the slide clamp to pinch the tubing, blocking the flow. Once the syringe is placed into the pump will begin the flow when the clamp is released. If you're using the VersaRate flow controller, make sure that the dial is set to the off position. Prepare the skin according to your healthcare protocol using an alcohol wipe. Remove the protective cover from the administration set, fold back the wings, and remove the guard from the needle. Then insert the needle into the skin at a 90-degree angle. Make sure the wings are flat against the skin and apply the soft site dressing. Open the VersaPump by pressing the two buttons on the front and raising the cover entirely. Some effort is required to open. Place the syringe into the pump with the syringe flanges fitting into the two slots with the markings facing up. Then close the pump's cover until it snaps closed. Before starting the infusion, place the VersaPump infuser on a stable horizontal surface or use the provided carrying case or hanging hook. The carrying case should be placed over or across the patient's shoulders, and the zipper should be aligned with the viewing window on the infuser. Now, unclamp the hose and the flow will begin. In the case of the VersaRate flow controller, turn the dial from off to the setting required per the chart in the user manual. During the infusion, you can monitor progress by looking into the pump at the graduations on the syringe. The infusion is complete when the syringe is empty. When the infusion is finished, or if you want to pause the infusion, you can use the slide clamp or turn the VersaRate flow controller to the off position. Open the pump by pressing the two buttons on the front and raising the cover entirely. Then remove the syringe. If needed, the pump can be cleaned with 70% isopropyl alcohol wipes or a soft cloth dampened with a weak solution of mild detergent and warm water, then closed and set aside. The system can now be disconnected, the dressing removed, and the needle removed. Fold down the protective wings for safety. The subcutaneous infusion set, flow controller, and syringe are single-use only and should be disposed of in an appropriate biohazard or sharps waste container. The VersaPump infuser, carrying case, and user manual can be placed back into the box for storage before the next use. This concludes our training on the VersaPump infusion system. Thank you.